a normal, so Paul's gonna switch between the regular cameras and then this. Yeah. Not the extended.
Yep. My plan was to see if anybody shows up who's no interest.
Oh, we have to keep.
Yeah, but I was gonna keep an eye. If somebody needs to participate in the audience,
You see Beth out there?
I saw her car up in the back.
Beth or Dr. Karen?
Beth, her car is up there in the parking.
It's, Ari Crown's a new school, right? That was, we approved, or is someone approving?
Yeah, that's why
Yeah.
Mark, is that Mark?
Yeah. Hi, Paul. What? All right. All right.
Call Ralph.
Oh, I see.
Hello.
Good evening.
Good evening.
Hi.
Can everybody hear? Okay.
Yes.
Good evening and welcome to the Village Board meeting for Monday, April the 6th, 2020. Before advancing the meeting to its agenda for this evening, I would like to make a brief comment. As everybody can see who is viewing, we have an unusual circumstance this evening. Until further notice, meetings of the Skokie Village Board will be held electronically, with a majority of elected village officials participating by remote electronic access in order to comply with the State of Illinois stay-at-home order. Members of the public who wish to comment on an item on the published agenda or to comment during public comments should submit their statement or question in writing to the village manager's office no longer than noon on the day of the scheduled meeting. all properly submitted statements or questions will be presented and read during the relevant portion of the meeting this evening and in any future such meeting. Written comments may be submitted by email to citizencomments@skokie.org or by mail to the Village of Skokie, Village Manager's Office, 5127 Oakton, Skokie, Illinois, 60077, or via the village's drop-off location, which is by the public entry to Village Hall. This evening, we do have myself, our corporation counsel, our village manager, our village clerk, and a couple other members here with us. The purpose in doing that is because this is something new for all of us. I'm going to ask everybody to be very patient with me tonight. It's the first time I have ever chaired a meeting by Zoom. Also, we've decided that a few of us should be here tonight because there have been meetings around the country that have been hacked into the Zoom technology. We're not expecting that to happen this evening, but if it should, it was our feeling that somebody should be on premises. So we will now begin the meeting with the Pledge of Allegiance, which will be led by our village clerk, Pramod Shaw.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The meeting will come to order, and Clerk Shaw will please call the roll.
Trustee Roberts?
Here.
Trustee Sutker?
Here.
Trustee Ulrich?
Here.
Trustee Bromberg?
Here.
Trustee Klein?
Here.
Trustee Gray Keeler?
Here.
Mayor Mendoza?
Here we have a quorum. Next item on the agenda is approval of the consent agenda for this evening's meeting. A motion is in order. Trustee Roberts, seconded by Trustee Klein. Is there anything on the consent agenda anybody would like to have removed? If not, I'll call the roll,
Trustee
please.
Roberts?
Aye.
Trustee Sutker?
Aye.
Trustee Ulrich?
Aye.
Trustee Bromberg?
Aye.
Trustee Klein?
Aye.
Trustee Gray Keeler?
Aye.
Mayor Mendoza?
Aye, the motion passes. The next item on the agenda is report of our village manager, John Lockerbie.
Thank you, Mayor Van Duzen and village trustees. Good evening. The first item on my agenda this evening is regarding the COVID-19 presentation and update. Dr. Catherine Kennard, our Director of Health, will provide an update regarding the presence of COVID-19 in the community, and Beth Lindley, our Director of Human Services, will highlight the services the village is providing during the pandemic. Following their remarks, I will share some of the strategy and response that the other village departments are providing as well. And with that, I'll turn it over to Dr. Kennard.
Good evening, Mayor Van Duzen and village trustees. Thank you for the opportunity to speak with you about the current COVID-19 situation. This is a challenging time, and I want to thank all of you and those who are listening in for pulling together to prevent the spread of disease and return our lives to normal as quickly as possible. During this time, where the number of cases are increasing and the situation is rapidly changing, the Skokie Health Department will continue to respond and take every step possible to protect the health of the people living and working in the village. I want to highlight that the village has established a web page devoted to our COVID-19 response at www.skokie.org. This webpage includes daily confirmed case numbers, answers to frequently asked questions, guidance for preventing the spread of COVID-19, and what to do if you are sick. I want to acknowledge our Public Information Officer, Ann Tennis, who's done a great job of keeping the information on the page current. We recently added a graph that shows the total number of confirmed cases of COVID-19 in Skokie residents over time, since the first case was diagnosed on March 14, 2020. As of this afternoon, there have been 154 Skokie residents confirmed to have COVID-19. These residents range in age from 3 months to 92 years. About 70% of the cases are in people less than 60 years old, and the majority have been able to stay home, recovering in isolation from others. These Skokians come from all walks of life and live throughout the village. Unfortunately, I am sad to report that there have been 7 deaths, all in people over the age of 60 who had underlying health conditions. My deepest condolences go out to the families and friends of these individuals who were beloved. My parents are both in their 80s and, fortunately, in good health, but I'm deeply concerned for their well-being during this pandemic, as I know you are concerned for your family members. The deaths in older individuals highlight the crucial importance of following Governor Pritzker's stay-at-home order, even if you feel well. Every case is being interviewed by either health department staff or by licensed physicians and nurses who are members of the Skokie Medical Reserve Corps. In every instance, close contacts of cases are being identified and asked to stay home in quarantine away from others for 14 days until we are sure they do not develop symptoms. I am pleased to report that as of today, 22 people have recovered from COVID-19 infection in the village, and 114 people have been released from quarantine. The Skokie confirmed cases are just a small part of the nearly 9,000 cases in Cook County as a whole, including the city of Chicago. Governor Pritzker has emphasized that the current limited availability of COVID-19 tests in Illinois means we can expect that there is much more disease circulating than is being confirmed by testing, because many people with milder illness are simply staying home until they are well and never getting tested. We're fortunate to have our wonderful partner North Shore University Health System performing COVID-19 tests in the village. If you're experiencing symptoms consistent with COVID-19, such as fever, cough, congestion, sore throat, or difficulty breathing, especially if you are over the age of 60 or have significant underlying health conditions such as asthma, heart disease, or diabetes, please call your doctor. Either you or your doctor can call the North Shore Community Health Hotline at 847-432-5849. That's 847-432-5849 to see if you should be tested. That information is on our website under the tab, What to Do If You Are Sick. If you do not have a doctor or health insurance, there are 3 federally qualified health centers serving Skokie that will provide care regardless of your ability to pay: Erie Family Health Center, AHS Family Health Center, and Heartland Health Center. There is a link to contact information for these clinics on the Skokie COVID-19 webpage. In order to limit the spread of COVID-19, the village has implemented and is rigorously enforcing all of the social distancing measures required by the governor's executive order. Park district facilities, schools, child care centers and homes, the public library, and all non-essential businesses are closed. I've been impressed that most Skokie residents understand the importance of staying home and are only going out for necessary trips to the grocery store or for needed supplies, unless they are essential workers. Businesses in the village, with few exceptions, have closed or modified their practices consistent with the governor's order. The health department has worked with essential businesses, restaurants, and grocery stores, for example, to ensure that appropriate measures are in place to protect workers and customers. and we have promptly responded to any reported concerns that people are gathering in ways that could contribute to the spread of COVID-19. One question I have received is what we think the future holds as far as when the number of cases of COVID-19 will peak in Illinois. That's hard to predict, as this is a new virus, but looking at prior disease outbreaks, such as the 1918 influenza pandemic or the 2003 SARS global outbreak, this first wave will likely pass over the next 2 to 3 months. Whether that means the disease will decrease significantly over the summer and return aggressively in the fall with another wave is not clear. We may be in for a rough year to 18 months ahead. But how this first wave proceeds, the number of people who are infected, the number who will die, and whether our healthcare system will be overwhelmed depends on you. The best thing that you can do to flatten the curve is to stay home. As you have likely heard, according to the Centers for Disease Control and Prevention, or CDC, recent evidence indicates that up to 25% of people with COVID-19 infection may not have symptoms and can still spread the disease. It's very important that you stay home, even if you feel well. If you must go out, please keep at least 6 feet between yourselves and others. Social distancing, along with the other measures to protect yourself from infection, such as frequently washing your hands and frequently cleaning high-touch surfaces such as banisters and doorknobs, are your best line of defense. Last Friday, the CDC recommended we wear a simple cloth face mask covering over our mouth and nose whenever we are in places where it's difficult to keep 6 feet between ourselves and others, such as grocery stores and pharmacies. One benefit to wearing a mask is it may help anyone who has the virus but doesn't know it because they don't have symptoms from spreading COVID-19 to others. I think it's a good idea to put on a cloth mask whenever you leave your home. Cloth face coverings can easily be made from everyday items, even if you can't sew. We have information on how to make a mask on the Village website, including a video from Dr. Jerome Adams, the U.S. Surgeon General, showing how to quickly make a suitable mask from a t-shirt and 2 rubber bands. It's important to mention that the cloth face coverings CDC has recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders who are providing care for people seriously ill with COVID-19. As I conclude my remarks, I must mention that our health department was established in 1907 by Mayor Dr. George Sinsel, who was a physician. And more than 50 years ago, health department services were expanded in order to become a state-certified department under the leadership of Mayor Albert J. Smith. Today, we are only able to have a strong local response to this public health crisis because of the foresight of our predecessors who placed a priority on the health of the community. And I'd like to thank today's leaders too, Village Manager John Lockerbie, all of the department heads, including our chiefs of police and fire, Mayor Van Duzen, Mr. Lorge, and our trustees for working together to overcome this challenge. Thank you as well to everyone who's watching for your cooperation. It may not feel as if you're doing much to limit the spread of COVID-19 by staying home, but you are. That's our best defense. Thank you to all who are contributing to this effort. And that's all I have for today.
Thank you. Does anybody have any questions? Trustee Sucker.
I've had a few questions about our numbers versus other municipalities' numbers. I wonder if you can clarify that for us as to why that would be.
Sure. I think, as I was mentioning, 142 is a small number out of 9,000 in Cook County. And really, I do believe that because we have ready access to testing, that leads to us appearing to have perhaps a few more cases here. But there's not a significant difference between ourselves and Evanston, say, who's next door to us. It's really a rough guide because we aren't able to test everyone in the community. We really don't know what the rate of transmission is. There are many people in the community who have disease who have not been tested. I don't know if that answers your question, but I do not think that is a statistically significant difference between ourselves and other communities. It really is a reflection of a few more tests being performed on Skokie residents than in neighboring communities.
Well, I was looking at some of the figures latter part of last week, so I don't know what's happened since Friday, but Evanston was about 10 behind us, and Glenview was very close to Evanston. So Evanston, Skokie, and Glenview are all very close together. And it struck me that those are three communities that have hospitals in them. And the community in Lake County that has the highest number is Highland Park, which also happens to have a hospital. I don't know that this observation is the least bit scientific, but I'm wondering if there's any correlation to the number of tests that are being done in those municipalities, because two of them have Evanston and Skokie have municipal departments of health, but all four of us have hospitals that may be doing testing. Do you think there's any correlation, or am I imagining?
Absolutely. It is a feature of being able to get a test. 3 times a week, I'm on calls with the health departments across the state, and many places do not have access to testing at all currently, or if they do, the tests are being performed by private labs such as Quest and LabCorp, where they have currently a 10-day delay or longer in getting test results back because they have such a large backlog. It's really a very significant problem in the state as far as trying to characterize the disease. We are very lucky that we have North Shore, because if someone gets tested there, they do get the test result back within a day or 2 at the most. And I think that's why we're seeing the number of cases. There's going to be a delay in some of these other communities that don't have the access that we do. But again, I think the main point is to emphasize that the number of cases overall is going up, and they're going up significantly across the state, in all corners of the state, as Governor Pritzker has said. And so we all need to exercise caution, and you can use that as a rough guide. But trying to compare one community to the other is very difficult. The state is not releasing data at the municipal level, only at the county level because of that reason. But of course, every municipality would like to know. So if you have cases in your municipality, you should be concerned.
Any other question? Yes, Trustee Ulrich.
I have a request and a question. I want to thank you, Dr. Kennard, for all the hard work you've been doing. I know you've been inundated with questions and meetings. We spoke earlier this week, and my request is that you calm me down about the food delivery system and how safe it is to get food from our local restaurants and places. And I thank you for that conversation. And the second question is, we've made a big deal about, getting tests done to test for COVID-19. But I think that my question is basically to test for antibodies that would enable us to be able to go back to work and be less fearful with contacting it. When do you anticipate that will be, that we'll get that?
This time, I know that a number of tests are being looked at, but I don't think that we've received any guidance as far as being able to, we're not even able to test people to see whether they have the disease. Then trying to think of testing to see if they have antibodies would be another level. It certainly will be something that we're looking at, and I know in the healthcare system that's something that would be of concern, to try to have workers who have antibodies be the ones that are more on the front line. But there's nothing in place at this point. On the screen, I don't know if that makes me look at an odd angle to you or not.
Trustee Roberts.
I'll look over here.
Hi, Dr. Kennard.
Hi.
Thank you for your good work. I wanted to ask, based on your current knowledge as of today, what reassurance can you give to our residents in terms of if they do need a test and if they need to go to the hospital, what is the current bed situation in our local hospitals of our partners?
Sure. We are in regular communication with North Shore University Health System. Of course, they're not the only health system. We also have St. Francis and Amita Health System, as well as the Advocate Lutheran General Health System, which many of our residents use. But we've been in communication most closely with North Shore because of Skokie Hospital being in the village. And I've been impressed with their complete reorganization of how they're running their hospitals. They're taking this very seriously. The fire chief and John Lockerbie and I are having regular communication, and currently they have sufficient beds and sufficient supplies to meet the needs that they project over the next couple of weeks anyway for the residents of Skokie and others in their the area that is served by that hospital system. But we're frequently in communication with them to monitor how things are going. And interestingly, Dave Rahia, the president of Skokie Hospital, shared with us that the number of visits to the ER has decreased, partly because people are staying home and we're not having the accidents and injuries and so forth, but also many people who might have gone to the ER just for something that would be potentially more minor are not coming. And so they certainly feel they have capacity at this time. And they've completely reorganized how they're doing things. Most of the COVID-19, people who have COVID-19 are being taken care of at Glenbrook Hospital. And they have built the hospital in a way that was in preparation for a pandemic. And so they are utilizing it in the way that it was built, every inch of it.
And there's a drive-through on Woods Drive? Is that where they're doing the drive-through?
Yes, they're doing testing. It's not exactly a drive-through. You do need to call the number that I gave earlier and get an appointment. And so it's by appointment only, but people are able to drive up and get a test performed.
Thank you.
Sure.
Okay. And Beth, do you have any comment you would like to make regarding your department?
Did anyone have any other questions for me? Because I can
think
cede to,
Trustee Klein?
okay.
Is that, I
Yes,
can't
Trustee
tell if your
Klein.
hand is up.
Oh, hi Doc, how are you?
Good. Thank you.
You spoke about the people who were released from the hospital, so they must have some course of treatment. Is there anything you can speak to that?
It is supportive care. And if they need to be on a ventilator, they are put on a ventilator to help them breathe until they can breathe again on their own. And so what they get in the hospital is fluids if they need them, if they're getting dehydrated, medication to control their temperature and to help with their breathing, that sort of thing. But there's no specific treatment for COVID-19 other than supportive care in general.
Nobody speaks about the people who are working on this cure or whatever, this medicine. Is there anything you can
I would have to say that I'm not, you mean a cure for COVID-19? I have not heard of anything currently. I do know that a vaccine is in development, but that's likely a year to a year and a half away.
Okay.
Which is a preventative. But
The preventative.
as far as medications, there's not anything currently available.
But they are working on something, I hope.
Sure, absolutely.
But nobody knows it has any time frame on that.
I don't.
I was only hoping. Thank you, Doc.
Sure. Anything else from anybody? I mean, I'm going to stay here for Beth's portion too, if you think of something and want to ask.
I have another question, Dr. Kennard.
Sure.
Thank you. These are questions that have been asked of me, and so I feel like I should ask them at this meeting.
Yeah, sure.
Another very common question is there a cluster of populations or people that are getting this disease? And from your numbers that I see reported, there doesn't seem to be
No.
any kind of.
No, there isn't. And I know in some other communities there have been large outbreaks, for instance, in long-term care facilities. We have not seen that in Skokie. We are fortunate that decades ago, the Village Board of Health, back in the 70s, made the determination to have the health department inspect long-term care facilities and also daycares and independent living facilities for people who have disabilities. Every other month, we go out to facilities in the village, and so we have a really close relationship with all of those organizations and entities, but especially the long-term care. And before there was a case in Skokie, we had met with them and implemented very strict measures. So we've had a handful of cases across our long-term care facilities and a couple in the independent living facilities, but we've been able to make sure there hasn't been a large outbreak. So we don't have any clusters. As I mentioned, the cases, when we look at them, they're pretty much spread out across the village. All different ages, different walks of life.
Thank you, and thank you for everything.
Sure, sure. And I'll stay if anyone has anything else.
Thank you. Beth?
Thank you, Mayor Van Duzen, John, and village trustees. I would like to begin by saying how grateful I am that the Human Services Division moved in as office mates with our health department colleagues around this time 6 years ago. We were given an opportunity to share time, space, resources, and new relationships with our public health colleagues, as well as others throughout Village Hall. And I'm especially grateful today to work in collaboration with Dr. Kennard and the dedicated personnel who staff our demanding call center, provide care and expertise to the residents of our community. Dr. Kennard has provided brave leadership and thoughtful guidance to help us understand and act on successful mitigation approaches. She has calmly helped to guide our thinking about next steps and advise best practices during a world pandemic. So thank you. What follows is a summary of Human Services efforts during the last month. During this time especially, Human Services has been concerned with the many challenges people face when they are homebound. We've been in contact with the providers in our community and have helped to coordinate volunteer support to provide food and resources to those most vulnerable members of our community. I cannot overstate my gratitude for the many community members, leaders, school personnel, colleagues at the Skokie Public Library, and area nonprofit organizations who have mobilized to offer their help and support. Because of these relationships, our partners have been able to make fast decisions to mobilize around community needs. Our schools regrouped quickly to provide lunches to families whose kids would have otherwise received free and reduced lunches were they still in school. And the Niles Township Food Pantry has mobilized and ordered surplus food, as did our home-delivered meals providers, to make sure that people in our community would have food security. We have worked extensively with the Niles Township Food Pantry and neighboring township communities to prepare emergency food packages. With the support of close to 100 volunteers, we supported the food pantry with the packaging and distribution of emergency food packages at their Main Street location and at an additional pop-up site at 8300 Lehigh in Morton Grove. A large warehouse space for packaging and distribution was provided there by the Village of Morton Grove. Patrons are able to drive up and have boxes loaded directly to their car to minimize contact. And the food package contents will vary week to week, but the intent is to provide a week's worth of food for each household in need. For the coming week, for example, packages will include toilet paper, Tylenol, and hand soap, in addition to produce and other shelf-stable items like juice, rice, dried fruit, pasta, canned soups, meats, and beans. We have also been in touch with Senator Ram Vilivalam's office, where they have launched an extensive effort to coordinate volunteers to provide well-being phone calls and food delivery to residents throughout the neighboring area. A group of young adults, the MCC Youth, reached out to us from the Muslim Cultural Center, and they have organized an effort to deliver groceries to seniors who are homebound in Niles Township. They pay out of their own funds first, deliver the order, and receive reimbursement from the residents to whom they deliver. They have also helped when people couldn't afford to pay, and will deliver from the food pantry as well. On March 20th, with the help of multiple departments throughout the village organization, Human Services began making well-being phone calls to residents over the age of 60. The contact information was informed by contacts in our Human Services database. 1,600 calls have been made so far, and the responses from those contacted have been overwhelmingly positive and thankful. Human Services staff follow up with any urgent concerns that are expressed during these calls. The Skokie Community Foundation has generously provided the Village of Skokie Human Services with a $10,000 flexible funds grant to allocate to Skokie residents who have been financially impacted by COVID-19. They have also launched a fundraising campaign, which is linked on the Skokie Spirit Shines Through page on our website. Last week, the Niles Township Rotary Organization put out a call to their membership to invite donations, and there has been positive response already. We worked with the manager's office to create an online application for the Flex Funds grant to assist with community emergency financial needs, and that is also available as a link on the resource page of the COVID-19 resource page. Home delivered meals providers that include CJE and Meals on Wheels Northeastern Illinois have also mobilized to provide weekly delivery to their participants in order to have additional stockpile of food for those participants and have the food that they need. We were in contact with Connections for the Homeless, who has temporarily housed nearly 100 adults experiencing homelessness with arrangements they have made with local hotels. This provides safe shelter for these individuals who otherwise had no place to go during the day or overnight. We have worked with them to help shelter several individuals we have known in Skokie who did not have permanent shelter. With parallel efforts through the Skokie Public Library and lots of support from them, and the Skokie Spirit Shines Through campaign, we are looking to neighbor relationships that have thrived across our community and asking for their continued support and efforts to help each other in the spirit of kindness and shared humanity. Human Services staff have been gathering resource information about food delivery options, applications for unemployment, navigating SNAP and Medicaid benefits, and how the CARES grants will be received and delivered and when they might be expected. Assistance to prevent homelessness and services for people experiencing homelessness. In the days and months ahead, we remain concerned for the many who have lost employment and their incomes due to the stay-at-home orders. We will do all we can to connect people with the supports available to them, to assist them in applying for unemployment benefits and assistance programs to address their needs. Residents can contact us at 847-933-8252 with their questions. Thank you for the opportunity to share this update with you.
Thank you. Before turning to the board for questions, I just want to make one brief comment. I've been particularly inspired by a lot of our residents. The outpouring of volunteerism has been inspiring and uplifting. The number of people who have commented on social media or taken truck and used the sidewalks to express their gratitude for their neighbors and friends and to wish everybody well. There are young people who have created rainbows and put them in the windows of their homes. I hope those who hear us this evening will know that all of those expressions of neighborliness in spite of our separateness, are most welcome and are inspiring. I do want to thank, because I see them coming in to Village Hall to help out, the Medical Reserve Corps has done contact tracing for us to help us try and prevent and to help anybody who might accidentally be infected but maybe are unaware. I also continue to be concerned about our police and our fire department officials who go out every day and are meeting all of the daily emergencies that do come about. And the health staff, the human services staff, are truly overtaxed, and we want to thank them. In the food pantry, as Beth just pointed out, they always come through. There are also a couple people I would like to single out, and it's always dangerous to do this, I know, but I'm going to stick my neck out a little bit. One is a longtime friend of the village who twice a year goes to the Philippines to deliver medical instruments and medicine. Jelly Carandang, former member of the Skokie Plan Commission. She has risen to the occasion and used her sources to help raise equipment for first responders. Also, Denise Stonebeck has helped raise equipment for Swedish Covenant Hospital. All of these kinds of things are gratefully acknowledged. And also, I want to thank the public officials, starting with Governor Pritzker, our congressional delegation, our state reps and state senators. They haven't waited for us to call them, they've called us. And Mayor Lightfoot's office has also reached out, and we have been doing weekly phone calls with all of our leaders in both the Senate, the House, and our colleagues throughout the state of Illinois. This truly has been a collaborative effort, and I think it does show the kind of planning that happens day in and day out and is not particularly glorious. But when an emergency of this magnitude hits, I think it begins to show. So to all of those who have helped us and who are working cooperatively with us, thank you very much. Your help is gratefully appreciated. And does anybody have any questions of Beth? Trustee Sutker.
Hi, Beth. Thank you for everything. I know, as you know, I'm a social worker, and I know that people are going to be looking for a lot of resources. And so I wanted to let you know that I know that NAMI has a whole list of resources for every kind of need that somebody might have, whether it be financial or mental health. But I did want to say during this time, emotionally, people are really struggling, and I wanted to offer that JCFS Chicago has a warm line, and so does NAMI also has a warm line. So what the line is people can call and just talk to somebody if they feel like they're not able to cope, or they just need somebody to talk to. There's no charge for it. It's not for urgent needs, but I wanted to offer that phone number to our residents. It's 855-275-5237. I know a lot of, just because of what I do on a daily basis, that right now a lot of parents are really struggling because they have to help their kids with the e-learning, they're working at home, and they're trying to figure all this out. So it would be, probably a good resource for people to know about, and to thank you for everything you're doing. Thank you.
Thank you.
Beth, thank you.
Thank you so much.
Next item on the agenda is Budget 2020-21 update.
So the village approved a 2-year budget last year. May 1 will start the second year of the budget. Originally, a budget workshop was planned for April 27, but has been postponed until a future date. We're updating our financial projections, but during this stage of the international coronavirus pandemic, it is very challenging to refine our forecasts. In addition, there have been several telephone calls with state and federal legislators to clarify the financial assistance the village may receive to partially offset this health crisis. The appropriation ordinance that establishes spending authority will be brought to the village board within the first 60 days of the fiscal year as required by state statute. And there's no action required tonight. This is an update, but I'd be happy to answer any questions.
Does anybody have any questions? Trustee Roberts.
Hi, John. I know it's still very early, and we don't know how a lot of the processes are going to play out, but it seems to me that, I've heard estimates of 10 million people being unemployed at this point now, and as a result of that unemployment, people are going to lose their health insurance if it's tied to their job. So it seems like two of the most immediate concerns are helping people to apply for unemployment and helping them possibly to sign up for their own health insurance if need be. I know that we've kind of reached out to you today to kind of advance those ideas, and they're early on in the process, but I would really, in the next weeks, I'd love to be able to hear what the staff has to offer or suggest about this and how we can help our residents with these two aspects of their immediate needs.
Great. I appreciate the question and the comments. The Human Services Division should definitely be contacted by folks that are having financial issues or looking for those specific areas. Under Beth Lindley's leadership, we have started to evaluate how we have handled those specific issues, unemployment and health insurance for those people who lose their jobs, to see how we've handled it in the past and how we can handle it now and going into the future. And so those are definitely two areas that the Human Services Division has resources to assist people today, but those are mostly in place prior to the pandemic. So we will continue to refine our approach for those issues, and we'll be back in touch with more details.
Thank you.
Items C, D, E, and F were approved under tonight's consent agenda, and that completes my report this evening.
Thank you. Next item on the agenda is report of our corporation counsel, Michael Lorge.
Thank you, Mayor, trustees. Items A, B, C, and D were items on the consent agenda at the beginning of this meeting, and they were adopted at that time. Item E is a request for a motion. It is a motion requested to extend the Village of Skokie emergency declaration for public health necessitated by the COVID-19 pandemic. This was enacted by resolution number 20-3-R-1460 on March 16, 2020. In recognition of the extension of the federal emergency declaration and the extension of Governor J.B. Pritzker's executive order, it is necessary for us to take this step to extend our emergency declaration. Therefore, pursuant to Section 3 of the Village of Skokie Emergency Declaration, this motion would extend through Tuesday, May 5th, 2020, authorization for the village manager to establish administrative rules and procedures for the continuation of Village of Skokie finances and operations. This includes any and all payments and financial actions to ensure the continued and uninterrupted day-to-day operations of the village. Mayor, I would request board action for a motion on this tonight.
A motion to extend the village's emergency declaration for public health up to and through Tuesday, May 5th, 2020 is in order. Trustee Gray Keeler, seconded by Trustee Klein. Are there any comments or any questions? If not, call the roll, please.
Trustee Roberts,
Aye.
Trustee Sutker,
Aye.
Trustee Ulrich,
Aye.
Trustee Bromberg,
Aye.
Trustee Klein,
Aye.
Trustee Gray Keeler,
Aye.
Mayor Van Dusen.
Aye, the motion passes.
Thank you, Mayor. That would conclude my report for this evening.
And John, did we receive any question or comments for citizen comments?
Yes, we did. Madeline England sent in 2 comments this evening, or for this meeting this evening, I should say. First is, given the CDC recommendation that all people wear masks in public and there being a shortage of masks, does the village have any plans to assist residents in obtaining supplies? And so, as Dr. Kennard mentioned earlier this evening, we are promoting people utilizing resources that they have at home to make their own masks, and the village's website has several links to those opportunities. But there's ability for people to make their own mask at this time. There are also nonprofit organizations in the community that are making masks, and so there may be more information regarding those upcoming as well.
Do we have a list of those not-for-profits or?
The Douglas Center is currently the one that is involved. Their distribution and so forth, I'm not sure that all of those logistics are known at this point, but they're in the process of making a number of masks. And then Ms. England's second comment is, how is Skokie planning to use the aftermath of the COVID-19 crisis as a growth or retrenchment strategy to propel Skokie, specifically the downtown areas? Can we create a development opportunity to incorporate innovations that are edgy and further both the economic and social development of the community? We will definitely keep these questions in mind as we move forward, and I will be in touch with Ms. England in order to follow up with this.
Great. Are there any concluding comments or questions of the village board? If not, Trustee Roberts.
No, I wanted to ask John sooner than during his report, but the other thing that occurs to me that's important is the new Federal CARES Act seems to be a Christmas tree of all different types of grants and funds that we may, as a village, be able to utilize. And I don't know if we have the current staff that can do that work, or if we need to contract with a specialist or someone who's an expert in this area. But it seems like there's literally billions of dollars that may be available both to the state of Illinois, Cook County, and to Skokie. So it seems to be something that's we would be able to get a return on our investment if we had to invest in order to get these opportunities. So I just wanted to ask, John's thoughts about that.
So there is a lot of conversation that's occurring on a daily basis regarding the stimulus and what it means for municipalities. Everything from the mayor and I participating on conference calls with our federal legislators and advocating for our needs there. The Northwest Municipal Conference has been active with Cook County. This morning, the village participated with President Preckwinkle regarding the county's role in accessing funds for us. There is an initial deadline of municipalities supplying an application by April 12th that our finance director, Julian Prindy, has already completed and submitted. It's a very basic form, but it starts the process for some of the reimbursement of direct expenditures that the village has incurred for COVID-19. The other components, there's still a lot to be worked out with those. I'm participating in a webinar session this week to discuss some of those opportunities for municipalities. But the ability for municipalities to address the loss in the economic revenue sources that municipality depends on is very much not what we are being communicated or not what we're being told at this point. And so definitely there's going to be some reimbursement dollars for municipalities with the response that we're providing. But the economic impact for the community and how that affects local revenue is not necessarily that clear cut at this point. And so we will continue to aggressively search for every dollar. And if it does make sense for us to involve other expertise, we absolutely will bring that to the board in order to make sure that we get the finances that were allotted and really fight for what we should receive.
And through IML, we have been doing weekly conference calls with Senator Durbin. And his office has been very helpful. Also, we did a conference call, Michael, John, and I, with Congresswoman Schakowsky. It's my preliminary perception that most of the money that goes to municipalities is going to go to those municipalities over 500,000. In the most recently passed CARES package, a very high percentage is earmarked for municipalities over 500,000. There may be some money here and there for us. We've been pointed in a couple directions by both of their offices, and that is something that we're pursuing. But the Illinois Municipal League has been very helpful. I serve on the board of directors of IML, and I've been in touch with the director of the league on several occasions now. And we're hoping that in the next bill, and there apparently is going to be one, they will be a little more cognizant of municipalities that aren't as large as 500,000. But it is a legislative problem that we have at the moment.
And I should also mention that the economic development staff is regularly in contact with our business community, both via telephone calls and reaching out in that manner, as well as emails and a resource page on the village's website. There's specific opportunities for daycare facilities that we've communicated to our approximately 50 daycare facilities in town. There's a number of opportunities for small businesses with payroll assistance and so forth. And so the economic development staff of the village is also working diligently to understand the stimulus bill and to share that information with the business community, and working with the Chamber of Commerce to partner to share the information in that regard.
Any other comments or questions? If not, Trustee Bromberg?
Mayor, I apologize. This is Mark Gershon. I tried to reach on. It may have just been a glitch in the system, but we did not see a vote on the consent agenda. If that occurred, I apologize for asking, but we had two people check the video while we were watching.
We took a vote on the consent agenda.
Yes,
Right.
we did.
My apologies. I didn't want you to go on. It must have been the video we had.
Yes.
Apologize.
Yes. My heart almost stopped.
Well,
Trustee
motion
Brown.
to adjourn?
We are adjourned. Thank you for your patience. I appreciate it.
Good night, all.
Thank you all.
Be well.